Hi, this is Dr. Michael Lovelace with Derby City Direct Primary Care in Louisville, Kentucky. I have a solo practice that I opened in 2020, so I've been open for about 6 years. And for the past year, I've had a virtual assistant through Coolblue VA. My practice is a hybrid. It's about 225 primary care patients. I also do veteran disability exams, FAA pilot physicals, and a good amount of my time is spent also in clinical trials. And my specialty is family medicine. My biggest challenge before having a virtual assistant was as I was getting more patients on my panel, the phone calls were increasing. I was also getting more inquiries from folks wanting to join and having to answer questions about what my practice is about, what direct primary care is, what the fees were. Since bringing on the virtual assistant, changes that have benefited me include having someone answering the phones, which frees me up to spend more time with patients and not be interrupted. I also don't have to worry about, at the end of the day, trying to read all the messages or get all the messages and figure out what needs to be done, because Mafel will provide me tasks to complete, and so I can see those pretty quickly once I come out of my appointments with patients. We have also been able to implement lab follow-ups. So from a clinical perspective, I would order labs in the past, and sometimes those labs wouldn't get done, and I wouldn't know about that for 6 months or a year when the patient came back, and then we realized that the labs hadn't been done. So working with Mafel, I'll put in the labs, she'll set up reminders for herself, which she will check in like 4 to 6 weeks. And if the patient hasn't completed a lab, she'll send a friendly reminder reminding them to get their labs done. She'll also send annual lab requests to our patients. So basically saying, hey, it's been a year since we've gotten your full annual lab panel. Would you like us to order those? And that way the patients are made aware of it. They give their approval for it, and then I can send in the labs. And then we can schedule follow-up visits when the labs come back. I also do FAA pilot physicals. So particularly class 1, that's your Southwest UPS pilots. They need a physical every 6 months or every year, depending on their age. And so I've started working with Mafel to send out reminders to pilots 5 months or 11 months after their last physical, again, based on their age. And a couple of benefits from that. One, I think it helps the pilot because it reminds them that they're due. We provide them the scheduling link so they're able to schedule 24/7 wherever they are in the world. It also helps ensure that I get their repeat business because they can do a physical anywhere in the world as long as there's an FAA medical examiner there. Other things that have improved, let's say, when I'm on vacation, Mafel is there to answer the phones, take lists, so then I can reach out to her every couple times a day and find out what's going on. She uses Spruce, or we both use Spruce, so she'll send me notes saying, this patient needs a refill, or this patient, sprained their ankle and wants to know if they should go to urgent care or get an x-ray, or, this patient is sick, here's what they're saying. And then I can then call them back or text them and basically take care of the whole issue in about, 5-10 minutes when I'm on vacation. So that really takes a lot of stress out of being away from the office. And then we've done a few one-off projects where I'll have her, let's say, analyze my prescribing activity for the past 12 months to get like an idea of like what's the minimum inventory I should have for certain medications. And like I said, she uses Excel, she uses pivot tables, and takes the data out of Atlas and is like really competent and skilled at that and takes initiative. And she'll also massage the data and say, well, I changed it like this, and do you want to look at it like that? Whether it's monthly or quarterly, like she'll make suggestions as well that it's helpful. I would tell them that I was hesitant to get a virtual assistant because I didn't think that I had enough work to keep them busy. However, what I would say now is I would say that it would be worth taking a chance, committing to a certain amount of time, whether it's 3 or 4 months, and seeing how the virtual assistant can improve their quality of life and their work life. I think that as they work with the virtual assistant and understand their skills, that they'll be able to find more tasks that they can offload to the virtual assistants, which will free them, either give them free time or free them up to do more clinical activities. Hey, Mafel, just wanted to say thank you for everything you've done for the past year. Really appreciated you keeping me on task and helping me with the patients. I really wasn't sure that I needed a virtual assistant, but after working with you for a year, I realized that I did. And I'm really glad that to have you helping me with my practice and with the patients. So just want to say thank you.